Hi everybody, it's Dr. Magnifico from JaredsvilleVetandPodly.com. This is my dog Jekyll. He is an 8-year-old beagle. He unfortunately has bladder, urethral, prostate cancer. We're actually not exactly sure, but he's got cancer in the bottom part of his urinary tract and also affecting his colon at the pelvis. So it's making it hard for him to urinate and defecate. He's an 8-year-old beagle. I have had him since the time he was an 8-week-old puppy. He was brought in to be euthanized because he had a prolapsed rectum. So he has been with me for a long time. We are very best of friends, and he really is, my pride and joy. He is the equivalent of my child. I love him to pieces, and it's been hard to, accept that he's got a terminal cancer, and it's hard to watch him struggle, and it's hard to feel like I'm a veterinarian with all of these tools and all of this access to amazing therapies and options, and I'm not significantly financially bound, and I still have a tough time, accepting the fact that there's not much I can do. We are trying to do everything we can, so that means I have talked to multiple specialists. I've actually talked to 3 oncologists and internal medicine people. I've referred all of his diagnostics out to boarded specialists to make sure that I am doing the best I can to get his diagnosis correct, to get his options all understood and discussed and find what might be best for him. In essence, I'm having a tough time accepting that he's got something that's so severe, and I'm having a tough time with the coming to terms with the fact that he might not be here in 4 to 6 months. His prognosis with transitional cell carcinoma of the urethra was about 6 to 18 months. Prostate is probably 4 to 6 months, and I'm doing everything I can to help extend his life with quality and meaning and joy for as long as I can. This is a video about coming to terms with accepting the death of your pet and the terminality of their disease, and it's also a video about understanding where to go and what to do. I've had a great number of discussions with some of my very closest friends about what their thoughts and their feelings are on and accepting saying goodbye to your pet and when to know it's time. I am the person who fights. That's how I'm genetically, wired. I don't accept not trying. So that's what we're doing. It means that I assess every single day independently. I just live in today. I watch him very closely, and I ask myself lots and lots of questions over and over every day. My goal is to keep him happy. I want him wagging his tail. I want him going outside and still doing the things that he loves as a beagle. I want to make sure he's eating and comfortable. So we have lots of options on the shelf for pain medication, and we have lots of options kind of in our back pocket for, the next step, or what happens if he doesn't respond to the treatment that he's getting, or what happens if we feel like we've exhausted all of the options with chemotherapy, and what happens if we feel like he can no longer, urinate or defecate. I want to know all of those things, and from the very beginning we have set out a plan. We've talked about what's the next step of the plan. I have people who I can count on and rely on. Some of that requires paying for it. So I have an oncologist who I work with very closely. We've discussed lots of different options, and she understands what I'm looking for with him and what I'm capable of, and how hard I'm willing to push, and even kind of thinking about options outside the box. So I think that all of us who have pets are going to deal with end of life things, and I think that in a lot of ways it really is the same way that we're going to deal with our own death. If you were given a terminal illness, what would you want to do? Some people just want to enjoy the last couple of days without wasting any time or energy, in a hospital or with specialists. Others of us want to fight for every last minute, as long as those minutes are quality filled and enjoyable. That's sort of the page that I'm on. Jekyll still gets up every morning. He does his little bed wiggle dance. He goes outside, he wags his tail. We go for runs, we go for walks, and he still loves being my dog and loves being here and does all the things that he used to do, like bark at somebody if they come down the driveway. We take great efforts to make sure that he's he's got lots of food options, and he's got lots of pain medication options, and he's got lots of support. I don't leave him alone. He stays with somebody now. If I have to go do anything, he's with somebody, so I make sure he's with somebody. That means I rely pretty heavily on my family and my clinic family to make sure that he's being watched and cared for. When he goes outside to defecate, he usually makes himself a mess, so I have to clean up after him. But that's what we do. I am here for him until the end, in the same way that I hope my family is here for me in the end, on whatever terms that may be, with whatever disastrous diagnosis we're given. But he still has happy days ahead of him, and we're going to do everything we can to maintain those, and to make sure that there are still many days ahead. If you have any questions about how to understand what a terminal illness is, how to define quality of life for your pet, and what it means for as far as costs and ethical dilemmas and decisions around end-of-life care, you can find me anytime at jarrettsvillevet.com. This is my dog Jekyll, and we have had a very good day today, and we're going to hope the same for tomorrow, and that's about all we're going to do. Take it day by day, plan for worst case scenario, and fight disease at every single instance we can. Thanks so much. Take care. Bye.